For the past few years, the Veterans Administration has increased the use of acupuncture medicine and related modalities. As the demand for these services increases, many Veteran Administration medical centers have expanded the availability of acupuncture. The purpose of this video is to provide a sample of acupuncture approaches and share the impact it has had on some within this population. At a few VA medical centers, there are contracted and Federal Service licensed acupuncturists that address a variety of presentations and offer many forms of acupuncture approaches. There are also other provider types that offer forms of acupuncture for veterans within some VA medical centers. Outside most VA medical centers, there are licensed acupuncturists who provide fee-basis acupuncture in the community when the demand for acupuncture services exceeds the 30-day wait, or if a veteran requires acupuncture approaches that are not feasible within a given VA medical center. Ear acupuncture is a microsystem that can affect descending pain pathways of the central nervous system and neuromodulate activity in the brain. Although ear acupuncture may not meet the standards of sustained pain reduction or functional improvement established by the Veterans Administration, it can provide temporary relief. Many providers at the VA can perform ear acupuncture, which can be helpful for those operating or functioning at a high level or at a low level when immobile. Another helpful acupuncture approach is dry needling. While acupuncture needles are dry, the term dry needling is now used to distinguish the insertion of a solid needle for the purpose of releasing a trigger point, hyper-irritated band, or knot in a muscle for the purpose of enhancing a physical therapy session. Until recently, research on acupuncture has been confined to a framework used to evaluate the efficacy of pain medication. Now there is research demonstrating the efficacy of acupuncture outside pain. The evidence is significant for veterans with complicated conditions or functional limitations. Techniques used by licensed acupuncturists determine outcomes. For example, using manual or electric stimulation approaches in a muscle motor point can reduce pathogenic fluid such as inflammation. Using a different technique in a muscle motor point can activate the function in another part of the muscle. These techniques, in turn, can often release a nerve, improve connectivity, or facilitate repair of a damaged myelin sheath. Many VA medical centers have hired highly skilled licensed acupuncturists who have completed a doctorate degree in acupuncture medicine, and many VA medical centers outsource to advanced licensed acupuncturists like us in the community. However, as noted in the chart, not all conditions require the skill level of a licensed acupuncturist, and as the demand for acupuncture amongst veterans increases, it is good to know that many medical providers are learning acupuncture approaches instead of pain medication. Veterans' primary care provider can evaluate which acupuncture approaches are available and determine the best level of care for the condition being treated.